Well, Dr. McGeer, I mean, we learn more about this virus every day. The medical community learns more week after week, but it also seems like there's a fair bit that we don't know about COVID-19. So what are our blind spots? What don't we know about this virus? And when do you think the medical community will fully understand it?
Well, I don't think there's a virus in the world that we fully understand. So our correct answer to fully is maybe never. But
Okay.
it's moving forward very quickly. And the big gap, for instance, a month ago was understanding what the asymptomatic fraction was, and we still don't have perfect eyes on that, but we were much better off than we were even a week ago, truthfully, in terms of understanding how many people have asymptomatic infections and where we are in the outbreak in different jurisdictions around the world. I think there's beginning to be quite a lot of information about the course of disease and the pathophysiology of what's going on. It's really interesting disease, I think, from a medical point of view about what's going on with people. And that helps with understanding how to respond to it. We were very quick to go to early intubation, for instance, which I think we're now recognizing is not a good thing for patients, often doesn't need to be done. People are starting to talk about proning patients as a way of improving oxygenation. So I didn't actually think when this started that we had a lot of options in improving management, but I actually think that's not true. I think we're learning quite quickly how we can do better for patients, because this really is a very distinctive disease compared to anything else we see.
Right. Well, and as time goes on, we're talking more and more about, and hearing more and more about the potential for a second wave or a third wave and beyond of this virus. So, Dr. Bogoch, what do we know about that, and what do you think a second wave could look like? And I mean, how do we prepare for that?
Yeah, I mean, it's neat because we can sort of look to other countries that are a little bit further ahead than we are in the course of the pandemic and really learn some lessons from them. And we've seen some countries in East Asia experience a bit of a second wave, some larger than others. I think the best thing we can do to prepare for that is really, number one, when we do decide to gradually lift these public health restrictions, I think it's important to do it at the right time and not lift those restrictions too soon. And then number two, we have to have some things in place in order to be ready to really limit the size of the second wave. One is we need incredible access to diagnostic tests. In addition to that, we really need personnel and technology to help with what we call contact tracing, meaning we would be able to rapidly identify anyone who's got this infection and the people who have been in close contact with that individual, and then support them. And the key word there is support them through a 14-day period of isolation so that they don't go on and spread this infection in the community. Of course, we know that not everyone has the same social safety net that other people have, and some people might need some help with a place to stay. Some people might need help with food or other essential items throughout their 14-day of isolation if they were a close contact or a positive case. So I think there's a lot of work that needs to be done on this front, but certainly if we really are mindful of those and we really prepare businesses and communities for the gradual lifting of these public health measures, I think we can successfully get through this and have a very small second wave rather than a rather large one.
Well, thank you both so much for joining us for the insight. I know you're both very busy, so we really appreciate the time, and thank you on behalf of all of us for the work that you've done and that you continue to do. It's an honor to talk to you. Thank you.
Have a good one. Thank you.